To briefly overview the report's key messages, we will start with the summary of the statement of task. Do I flip this or someone? No, I was, oh, that's one. In an effort to help better inform future public health decisions, the sponsors of the report developed the following charge to the committee. The committee was asked to develop a comprehensive, in-depth review of existing evidence regarding the health effects, both harms and benefits, of cannabis and cannabinoid use. It was also requested to make short and long-term recommendations regarding a research agenda to identify the most critical research questions and advance the cannabis and cannabinoid research agenda. To address the study's charge, the committee conducted a comprehensive review of current evidence related to the health effects of cannabis and cannabinoids. In their approach, the committee adopted key features of a systematic review process: a comprehensive literature review, assessments by more than one person of the quality of that is the risk of bias of key literature, and the conclusions, pre-specified questions of interest before conclusions were formulated. Standard language was developed to allow comparisons between conclusions and declarations of conflict of interest via the National Academy's conflict of interest policy were also discussed. Given the large scientific literature on cannabis, the breadth of the task, and the time constraints of the study, the committee developed an approach that resulted in giving primacy to recently published systematic reviews, that is published from 2011 to August 2016, and high-quality primary research, generally from 1999 to August 2016, that studied one or more of the committee's 11 prioritized health endpoints. The committee is aware that in using this approach, there's a possibility that some literature may have been missed. Furthermore, certain high-quality research studies may not have been reviewed in this report because they did not directly address specific health endpoint questions formulated by the committee. And these are the prioritized health endpoints. There are 11 of them in terms of talking about the various aspects of cannabinoids. Within the report, there are nearly 100 conclusions related to the health effects of cannabis and cannabinoid use. Here we'll present some of the findings with that the committee determined had the strongest evidence of support. These are, first of all, initiating cannabis use at a young age is a risk factor for developing problematic cannabis use. The second, pregnant women who smoke cannabis increase the risk that their baby will be born with lower birth weight. Third, long-term cannabis smoking causes chronic breathing problems. Fourth, some people with chronic pain, muscle spasms from multiple sclerosis, or nausea and vomiting from cancer chemotherapy obtain some relief of their symptoms from using cannabis-based products or cannabis itself. Researchers who want to study the effects of cannabis face substantial obstacles. Based on the research conclusions, the committee members formulated 4 recommendations to address the research gaps and to improve research quality, improve surveillance capacity, and address research barriers. Recommendation 1, to address research gaps. This was to develop a comprehensive evidence base on the short and long-term health effects of cannabis use, both beneficial and harmful. Public agencies, philanthropic and professional organizations, private companies, and clinical and public health research groups should provide funding and support for a national cannabis research agenda that addresses the key gaps in the evidence base. Prioritized research streams and objectives should include, but need not be limited to, clinical and observational research, health policy and health economics research, public health and public safety research. To improve the research quality, needs to promote the development of conclusive evidence on the short and long-term health effects of cannabis, both beneficial and harmful. Agencies of the United States Department of Health and Human Services, including the National Institutes of Health, the Centers for Disease Control and Prevention, should jointly fund a workshop to develop a set of research standards and benchmarks to guide and ensure the production of high-quality cannabis research. To improve surveillance, to ensure that sufficient data are available to inform research on the short and long-term health effects of cannabis, both beneficial and harmful, the Centers of Disease Control and Prevention, the Substance Abuse and Mental Health Services Administration, the Association of State and Territorial Health Officers, National Association of County and City Health Officials, the Association of Public Health Laboratories, and the state and local public health departments should fund and support improvements to federal public health surveillance systems and state-based public health surveillance efforts. And finally, addressing the research barriers. The Centers for Disease Control and Prevention, National Institutes of Health, Food and Drug Administration, industry groups, and non-governmental organizations should fund the convening of a committee of experts tasked to produce an objective and evidence-based report that fully characterizes the impacts of regulatory barriers to cannabis research and that proposes strategies for supporting the development of the resources and infrastructure necessary to conduct a comprehensive research agenda. Questions?